Good morning, everyone. Hope everyone had a great first day. Over here, I'm with my partner Brendan, representing mPulse, and I'm from Tata Communications. And what we'll be talking about is how can we drive communication and have higher efficiencies for interoperability when we look at the data that transmits through the healthcare systems. Quick introduction. My name is Priyank Parikh. I represent a business unit within Tata Communications that focuses on customer interactions. Along with my team, that's at booth 1144. What we empower is we enable different enterprises, brands, healthcare providers to interact efficiently with their customers through different communication channels, whether it's text messages, WhatsApp, voice call, video calls. We enable that over a secure and a scalable platform that we offer to different enterprises. A little bit more about Tata Communications.
One more, I think. There we
Sorry,
go.
just wanted to make sure we have the right slide. Thank you. So a little bit more about Tata Communications. Tata Communications is a part of Tata Group of companies. For whom you may not know, that's a 150-year-old business conglomerate, global, with $400 billion of market cap, over 1 million employees, and operating in over 100 countries. The line of business that we have is called customer interaction, where we focus on primarily two technologies. One is communication platform as a service, and second is contact center as a service. Different ways and different technologies that businesses use to interact and engage with their customer base. Some of the key capabilities that we have is one, our direct carrier connectivity across all major carriers in the United States and global countries. They allow us to power reliable, scalable communication over text messages in a very secure way. Our flexible APIs are what allows us to empower data exchange between different healthcare systems, applications, and devices, which in turn obviously allows us to seamlessly flow the data through the entire system and address the challenges that we have with interoperability. We have been doing this for quite some time, and we operate in a highly regulated market and industries. Healthcare obviously is one of them. So when you think about different connectivity and different access points that you have to interact with customers, it's very important for us to operate that in a compliant manner. So we are absolutely compliant with all industry related regulations that we have globally. HIPAA is an example over here in United States. And then it's obviously backed by our leading customer support team, which allows us to provide very high touch customer service, engage with customers more in a consultative environment, and make sure we are with them, guiding them through the entire interaction journey and different customer journeys that they want to execute between patients and the healthcare providers. We did talk about our capabilities. This is at the scale at which we operate. So as I said, the capabilities coupled with the high-touch customer service we have is what allows us to provide a very seamless patient experience, allowing them to engage and interact with healthcare providers in a secure and a scalable way. Now, what we have talked about so far is what we have been working on so far, what we have achieved so far in the last 20 years or so. What is more important is, in fact, trends that we are working on, technologies that we are working on. If we have to look at what our vision is to, in fact, reimagine the way enterprises interact, collaborate, and engage with humans, machines, and things, all powered by AI. The way we are realizing our vision is by two key strategic initiatives. One is merging the CPaaS platform and the CCaaS platform. Let me expand that in a minute. CPaaS is communication platform. So whenever you interact with patients, any healthcare providers using any of those channels, whether it's messaging, email, voice, whether it's one-way messages, OTPs, or chatbots, that all falls in the CPaaS category. On the contact center side, that's obviously when you're interacting with a live agent. Starts with a bot as well, and then you are having a live interaction with an agent. So we are in fact converging both of those to create a very unified customer experience view that allows us integration for data and I would say processes across different business units, and allows us to create a unified view of a customer, which again helps us bridge the gap of interoperability. Because when you think about it, it's not just in the healthcare space. Even customer interactions, these two are very distinct platforms, which is now coming together. So that's our first initiative. Second is, how do we enable customer interactions powered by AI? And for that, we are looking at driving higher efficiency areas we are targeting or functions we are targeting is around content creation, is around selecting customer segments, is around contextual delivery. So delivery of the right message on the right channel to the right audience, and then obviously measuring the ROI and driving higher efficiencies through analytics and reporting. So those are few of the key initiatives that we are driving. Obviously, we are partnered with all the leading enterprises in the ecosystem, as I said previously, compliant with all the different regulatory standards we have as well. Next, I'll pass on to Brendan, who will cover some of the trends that mPulse is observing through their customers in the healthcare space.
Thank you, Priyank. So mPulse is a health experience and insights company. Health Experience and Insights, or HXI, is a newer category within the payer technology space. It brings together three capabilities: predictive analytics focused on consumer behaviors, omnichannel engagement to engage those individuals, and then health portals to navigate them to services and resources that they need. And that happens within a closed loop ecosystem, so you can really orchestrate tailored consumer journeys. We do this for over 400 healthcare organizations, including 29 of the largest health plans in the US. And overall, we have about 4 billion consumer touch points annually. What we're going to talk about now are some trends in engagement. We're looking at the communications piece of this, the omni-channel engagement. And one of the reasons for looking at engagement rates is that it's a leading indicator of how successful a program is going to be. And so if you look here on the right, this is looking at antidepressant medication management compliance. If you look at the population that is highly engaged, they have a 65% compliance rate, which is much higher than even medium engagement, low engagement, and no engagement. And so we measure engagement rates by two measures. One is response rate on text messaging, and then the other is clicking on links as well. So if we look at how you can try and increase engagement, this data is looking at disparities that are covered by the health equity index that is overseen by CMS. And if you look here on the left-hand side, we've got individuals with disabilities compared against a normal population and looking at reach rates. So on the gray there, with no disability, you have a reach rate of 41% with just regular live agent outreach. You add SMS to that, and you increase that by over 11 percentage points for the normal population. When you look at that for the population with disabilities, live agent outreach is 35%. That's a 7 percentage point deficit to the regular population. But when you add SMS, you get it up to over 50%. And you can see that the disparity between the normal population and the population with disabilities is dramatically reduced. And we see a similar effect with LIS, which is the low income subsidy as well, that population too. And so overall, it shows that by leveraging a multi-channel approach, adding SMS to live agent outreach, you can reduce disparities in reach rate by over 64%. So what are some of the drivers that you have in addition to adding channels to increase engagement rates for healthcare messaging? And this is looking at a whole range of different programs that we have, starting from 0%. So what are the characteristics of those sorts of programs where you have very little engagement rate? It's basically spraying and praying. It's where you have a message that goes out from an organization that doesn't have a mature engagement program. The message is not tailored to the individual, and there's not much value associated with that message. And typically you see very low engagement rates. But when you start addressing those three factors, how mature is what's the relationship between the healthcare organization and the individual? And we see that those organizations who invest in their outreach programs, develop strategies to build trust within that channel, have higher engagement rates across comparative programs to those organizations that don't. So that's one piece of it. What can you do? You can do things like have a VCF card that's saved into the individual's contacts within their phone. That results, for example, in higher engagement rates. The next thing is building out programs that are tailored to the individual. This can be languages, that increases engagement rate, but also how you're phrasing the messaging and making sure it's really engaging and speaks to the needs of that individual. And then the third part is really just, is the program inherently valuable? And so you see here, you're going from, let's say, one-to-many outreach around a flu shot vaccination that you would typically expect to get engagement rate within about 5 to 10%, all the way through to we would describe as sort of care management programs where it's focused very much on highly specific content related to that individual, a lot of times around test results and clicking through to get test results. That's when you're seeing engagement rates in excess of 60%. And then does it generate an ROI? This is looking at telehealth appointments from a large mental health provider in Colorado. And you can see that by adding SMS to their appointment reminder outreach program, you got a 12.5 percentage point bump in attendance rates, or reduction in no-show rates, actually, within this program. And that had a dollar value impact on the investment in the SMS channel of a 37-to-1 ROI. So it's a really significant impact for in-person appointments, but it's also seeing that benefit for virtual appointments as well. All right, change in direction here. Coming in April 11th this year is some really significant new rules coming through from the FCC around TCPA, okay? And these relate to revocation of consent. And there are 5 elements of this rule that essentially give consumers more abilities and easier ways to opt out from any automated outreach program across pre-recorded voice and SMS. It's not just healthcare specific, it relates to all industries. And these are rules that are coming into effect in April, so just a couple of months. So if somebody opts out from a program, be it an IVR program or an SMS program, they are not opting out just from that program, they are opting out from all communications from that organization. So thinking about that from a healthcare standpoint, if you're a plan and you're delivering a text message flu shot reminder and somebody opts out for that, that health plan has to opt out that individual from all other automated communication from that plan. So if they're on a appointment reminder program, if there's a IVR care management voice outreach program, they have to be opted out of those programs. That's one. You have to be able to honor more opt-out variations. So if it's SMS, there's 7 keywords that you have to honor: stop, end, cancel, revoke, opt-out, unsubscribe, I think they are. But really interestingly, you have to be able to opt out any other reasonable response from that individual. And so what that means is you either have to manually look at all responses to see if any of those are opt-outs, or you have to have NOU to interpret responses to see that the individual is looking to opt out of that program. And the onus is on the sending organization, so the calling organization or the organization sending messages, to demonstrate that an opt-out is unreasonable. So if somebody were to say, I no longer want to receive these messages, the sending organization would have to interpret that as an opt-out because that's a reasonable opt-out. So if it were ever to get to court and challenged, the onus is on the sending organization that they have to demonstrate that an opt-out is unreasonable. Senders have the ability to have one clarification step within 5 minutes of that opt-out response. So they can send a message saying, this will opt you out of all messages. If you don't want to opt out, reply 1. And the onus is on the individual to proactively re-opt in back into those messages, back into that program. You have one chance at that within 5 minutes. And you have 10 days from an enterprise standpoint to trickle down any opt-outs across different departments, 10 business days. So these are effects that are coming into effect on April the 11th. And the requirement is that all organizations will need to be able to honor this new approach. Are consumers aware of this? So we did a survey, 79% of consumers aren't aware of it. We actually thought that that was a surprisingly low number. We didn't really expect 21% of consumers to be aware of these new changes. But either way, it goes to show that very few consumers are aware of this. When we asked how they would react to this, and if they knew they were opting out, what would they want to be able to do? They would want the ability to manage their preferences. And you see here that 76% of consumers said, yes, I would like the ability to manage the communications I receive. About 10%, 12% said they really don't care whether they receive communications or not. And 12% of people really didn't understand the question. They weren't really sure what they were meant to be doing in this instance. So they would need education around that. And why this is really important is that the vast majority of consumers depend to some extent on health engagement messaging that they receive. And you see here that 90% to at least a minimal degree depend on some kind of health engagement outreach to help manage their health. And so the challenge that organizations are going to face is that individuals may unwittingly opt out from programs. There's a compliance risk around that. The other piece of it is the health plan or healthcare organization will no longer be able to contact them and be able to deliver the types of engagement programs that those individuals use to help manage their health. So potentially there are fairly significant repercussions from an engagement standpoint, but also from a plan performance standpoint. And with that, I'm going to pause, and we can have 2 minutes if there are any questions. Happy to take any questions you may have. Yeah. Okay. So the question here, what would be a non-telemarketing method? Yeah, so that's great. Yeah. So telemarketing messages apply across all industries, and it's when you're promoting a sale, promoting a product or a service. Healthcare operates the majority of times on something called the healthcare exemption, which basically says if the content of a message or an outreach relates to areas that are covered by HIPAA, they're excluded from that telemarketing requirement, which basically means they have lower levels of consent required to be able to outreach to that individual. The way this new rule works is that if people opt out from telemarketing messaging, they are able to still receive informational and exempt messaging. But if they opt out from any exempt messaging, which is the healthcare exemption, they are then opted out from all messages. In the majority of cases, healthcare organizations are operating under the exemption. Very few healthcare organizations do telemarketing through SMS. So what that means is that if anyone opts out, they're opting out from all communications from that organization. Yeah. Good question. Thank you. Well, thank you for your time today. mPulse is at booth 1211. If you have any questions, please come over and we'll be happy to talk about that.
Again, we are guys at booth 1144.